So now Kathy Kim, who is our leader in stakeholder engagement, including patients, administrators, clinicians, will talk, as well as Hugo Campos.
Thank you so much. And I want to recognize Kate Marie, who's sitting at the middle table here, who is our project manager at UC Davis, who went through all of the detail that it takes to put this IRB protocol, including reaching out to every one of the PIs, making sure they were okay with every word in there, talking to all the project managers, managing all those changes. So she did an incredible job in getting it to the point where most of the sites have approved the IRB. So I'm going to talk about the central role of patients and stakeholders in governance, really focusing on how we're handling stakeholder engagement in the P-Scanner project. I have up here Hugo Campos, who is our patient co-chair for the advisory board, who's going to present a part of it with me. And our other patient co-chair here in the audience, Nikolai Kirienko, has also been an incredible partner. So tell you a little bit about what we're doing in the P-Scanner project, how we're approaching it, and then also give you a chance to hear from Hugo about the patient perspective on patient engagement, which I think is sort of an interesting perspective that we don't usually hear. This is our stakeholder engagement team. So we just mentioned our two patient co-chairs from UC Davis. It's myself, Kate Marie, Linda Zegan from our Clinical and Translational Sciences Center. We have a graduate student, and Marge Ginsberg from the Center for Healthcare Decision Making. From RAND and USC, we have Daniela Meeker and Dmitry Kodyakov. From UC San Diego, Howard Terrace, and from the San Diego VA, Carl Stepnowski and Dina Rivkin. So this is sort of the core P-Scanner team that's working on all of these issues. So I'll start out with our PCORNet definition. So our PCORNet is the Patient-Centered Outcomes Research Institute sponsored project that helps people and their caregivers communicate and make informed healthcare decisions, allowing their voices to be heard in assessing the value of healthcare options. So it's really this kind of research that we're trying to get engagement of our various stakeholders in the process. So we started where we will be presenting this actually to our stakeholder advisory boards in the coming weeks, but what are patient-centered outcomes research types of questions? So they're really from the patient perspective. So what are my options? And what are the potential benefits and harms of those options? So these might be treatment options, it might be different sorts of interventions, it might be medications, it might be procedures. What can I do to improve the outcomes that are most important to me? So not just what can I do to improve the outcomes that you as clinicians or you as researchers track, but those things that actually make a difference to me in my life. How can clinicians and the healthcare delivery systems help me make the best decision about my health and healthcare? So that's education, it's shared decision making, it's resources for patients and their family and caregivers to make those decisions along with the clinicians. So those are the examples of the types of research questions that we're really trying to get some stakeholder input on. So we're really in P-Scanner trying to make sure that we bring patients and other stakeholders into our governance process. So I thought I would start out with what is governance, because often people are not sure what's incorporated in governance and what's not. So we really take this governance scope from data governance. And that covers things that are the areas of important decisions that are made that are required for effective management of an effort. So in our kind of project, that might be things like decisions about who has access to data, who are the people that provide it, who are the people that can use it, what's done with it. Another kind of decision might be, what are the principles that we follow in terms of privacy, security, how the data is used, for what purposes. So those are the kinds of decisions that we make for P-Scanner in our governance decision making. And so you can see where the input of stakeholders would be really important to that. So if you're thinking about behaviors that people have around the use of data, the selection of the types of data you're going to use, what questions you're going to answer with that data, how that might be communicated, you start to see how important it is to have the patients who provide that data from their own healthcare encounters, or the clinicians who are the source of that data, or the researchers who are going to use that in a research project. How those stakeholder voices become really important in setting the principles for those kinds of decisions. The second important area in governance is who controls that decision making. So literally who controls it, where do they sit, who do they work for, and then how do they make those decisions. And so again, you can see why stakeholder input becomes really important when you're thinking about patient-centered outcomes research, that you have that variety of stakeholder voices in the actual decision-making process. So these are the P-Scanner's goals. You've already seen this this morning. We're really now going to focus today on the very first one, which is engaging stakeholders at the multiple levels of governance. So we do this in a couple of different ways. So we do have multiple levels of engagement. Our first level of engagement is the Stakeholder Advisory Board for Governance. So the objective of this group is to develop operating governance mechanisms for the network. So again, that's the domains of decisions we need to make, and it's the control of that decision-making process. So we want to develop how we're going to actually do this now. So this is coming out of the scanner work that preceded P-Scanner. So we came up with a framework. Lucella actually mentioned one of the papers that reported on the privacy matrix analysis that we did. We came up with a framework that's based on the National Fair Information Practice Principles for providing a mechanism for understanding those important decisions. So now we want to take that sort of theoretical, conceptual work and say, now how do we put that into practice? And so that's the role of the Stakeholder Advisory Board for Governance. The other role is that they help us to understand what the input that we're getting from the other stakeholder groups that we are engaging with. So they're sort of our master advisory board. So we have around 10 patients and advocates and clinicians as part of this stakeholder advisory board, and then they're joined by the P-Scanner researchers and technical resources in our meetings. So we've had our first meeting with them. We started out with a wonderful discussion about openness and transparency, which is one of those critical principles and in the Fair Information Practice Principles that really has to do with access to network resources. And so that will be one of the first things that they provide a recommendation for. The second way that we're engaging stakeholders is in our stakeholder research prioritization panel, and we just call this the panel. And the role of this group is to help us to select the research priorities that P-Scanner will focus on. So this will involve 360 patients, clinicians, and researchers. This is what we've referred to as the online Delphi consensus process using Expert Lens from RAND. But the second purpose of this project is to test whether we can have a very efficient and effective means of engaging a large number of stakeholders. 360 is a lot of people, and they're arrayed in 3 different sub-panels, one for each of the conditions. So it's a large number of people. You don't usually have an expert panel with 120 people per condition. But we'd like to see, could this scale to thousands? Could we go out to a PPRN and engage all of their members in a consensus process around setting priorities? Can this go out to a large, region? Some of the other IDASH projects. Could this go out to the people involved in Strongheart so that all those people are part of decision making about what happens with that data and what kinds of research questions could be answered with it? So that's the other objective, that we're trying to find that kind of efficient way of engaging a large number of stakeholders. So this is just showing you that we're going to have 3 condition-specific panels, and within each of those condition panels, we will have actually 4 sub-panels, one with patients only, clinicians only, researchers only, and then a mixed panel that has 10 of each. So we want to see what happens when you are with your own kind in terms of role, and what happens when you're in a mixed group. You get different kinds of discussion, interaction, and decision-making. So this is the Expert Lens consensus process. So we have a round 0, which is idea generation, and then people have some discussion around those. They do some voting, and they learn from each other, and then there's another round. So it's an iterative process, and at the end of that, you see what arises as the priorities. Then the last group is the Stakeholder Advisory Board for Education. This group is really designed to help us bring stakeholders into the process of preparing for the panel. So they're going to help us optimize that experience of the panel. So they're looking at our educational materials. They're looking at actually testing the prioritization process. They're going to be getting onto Expert Lens and giving us feedback on, is this a usable product? Is it really make sense for patients and clinicians? So they will help us make sure that that's a good process for engaging the larger group. And we have actually about 30 patients, advocates, and clinicians in that education advisory board. And the educational materials will be in this sort of form and very graphical voiceover PowerPoint types of educational materials that we will provide for the panel. And I'll end with this and then hand the mic over to Hugo, just to show you our levels of engagement with the various governance advisory boards. So along the horizontal is the level of intensity of engagement from low to high, and along the vertical is the governance, the level of decision-making in governance. So it goes from input to advice to recommendations to actual decision-making. So we do have 4 different groups here with different levels of intensity of engagement and decision-making, sort of culminating with our steering committee that has final decision-making. And now I'm going to have Hugo speak.
I don't have slides, but I brought my notes with me in case I tend to ramble. So I just want to be respectful to your time and attention. So when Kathy asked me to be a part of the stakeholder advisory board, I thought I'm sort of like the wrong person to I feel like to be in this role to some extent, because I know very little about research. So I thought, what can I do to add value to the conversation? The bar is really high, and there's a lot of trust in my ability to add value to the project. So and I've said this before, I think patients have traditionally brought their narratives to the conversation, and I think at some point we can't really just bring our narratives anymore. We have to kind of figure out a way to add value. And so what else do we bring to the conversation? And so this really raises the bar for us. And so I went back and I started asking around, kind of like trying to figure out what is the idea behind PCORI, for example. So PCORI, why is it patient-centered? Somebody had the brilliant idea of adding patient-centered to the Affordable Care Act, the Patient-Centered Outcomes Research Institute. Why isn't it just Outcomes Research Institute? What did they mean? What was the intention there? Why wasn't research good enough? Done in the way that it was done before? Wasn't it done well? So for you guys, it's like to some extent for you you're changing your perspective a little bit, in the sense that you're looking at patients not just as research subjects anymore, but also as somehow partners in research, and whatever that may be. And we're sort of like figuring out what that is. But for patients, it is a much taller step, a much more difficult challenge, I think, because patients are really kind of completely detached from research. We often just sign an informed consent, and that's it, right? So like I said, we know very little about research, and we're not really engaged. So there is a great deal of work that needs to be done in terms of patient engagement. Which is a criteria for PCORI. PCORI requires patient engagement, it requires patient-centeredness. And this is funny because we've been hearing about patient engagement for quite some time, and I always, and I feel like I've kind of gone along with it as well. It makes some sort of sense, but it makes a lot of sense from that side of sort of from your side, I suppose, from the side of the payer, from the side of researchers, from the side of providers. But from a patient, from the perspective of a patient living with a chronic condition, it doesn't really say much. In fact, I don't really want engagement. I what I really want is autonomy. I really don't want engagement with my healthcare provider. I don't want to go to the clinic. I don't. Every interaction that I have with the hospital, with my doctor, it is a reminder that I have chronic heart disease, and I will probably end up in heart failure and in AFib. So, I don't want that. What I really want is autonomy. I may want engagement when it's time for me to have, when I'm dealing with some sort of critical moment in my care, a moment of decision, or something is not quite right. But as I go about my life managing my condition, I don't really want engagement. So it sort of creates a real big challenge for us, particularly for patients on this project, because it is part of our job to engage patients. And so, and this is to some extent very, very, to some extent I do welcome the challenge, because it is something that we're going to have to figure out. But I think I have some ideas, I suppose. I think a way to engage patients is, and I've been thinking long and hard about this, and I think the way to engage patients is we really have to sort of educate patients. We have to educate people about the role of research. Why is it important? Why people should care? There are folks like Nikolai and I have been engaged in the movement of sort of participatory medicine and changing healthcare and all that in that spirit. For whatever reason, we've got our reasons, but it's in a sense that patients are the folks like my dad, who's 85 years old, lives with me. I'm his caregiver. He doesn't want to engage either. So there are some challenges there. So in educating patients and sort of creating, I think, the right environment for patients to have the ability to engage whenever they feel like they should. So I think that's it. I have a few other notes. I'm rambling already, but I'm thinking the point is, it would be great at some point for us to sort of, I think you all have done it, particularly Dr. Lucila, have done a great job in putting the P in scanner, and I think the next step for us is to make the P a capital letter and move it to the center somewhere in the acronym. So,
Thank you.
Thank you.
Thank you. Let me call the next speaker while we ask a question of the speakers, or maybe I pose a comment. It is a tall order to represent all the patients, right? And I think in a way that's what we are asking, and that's why I totally agree that it has to be way more than 360, 1,000, and so on. It has to be a process that there are more people involved. Otherwise, you get some point people who might be more vocal but not completely representative, or you get on your shoulders the responsibility of represent all the patients. So that's really hard. So I hope you understand the difficulties in running this kind of operation. And I thank you both for your participation. Thank you.